everybody, my name's Nicola and I'm one of the co-founders of S.A.L.V.E International. We're a small international development charity which is a partnership charity between the UK and Uganda, and we work with children living on the streets in Uganda. We've been doing this for 12 years now, and obviously within that time we've seen a lot of ups and downs, but we've never quite faced a situation like what we're in now, which is a global pandemic. We're all trying to do our bit wherever we are in the world to combat it. We're following government recommendations, we're following the recommendations of medical professionals, we're doing physical distancing from one another, and obviously we're practicing that here in the UK, and these measures are just starting to come into place in Uganda as well. However, the big issue we're facing in Uganda is there literally is no other safety net other than what we're able to provide. So we currently have more than 100 children who go to school under us, who formerly lived on the streets, and we're helping them to be able to get an education because currently their family can't afford to pay for them to go to school. We've already paid for their school meals for the term and we can't get a refund on that, and the children were relying on that for their food. We also have hundreds of children still living on the streets as well, who are relying on us for services in this really, really difficult time. And the number of children on the streets is only likely to go up. So in Uganda, we don't have anything like a food bank. There are no meal vouchers for children who aren't able to get their school lunch anymore. And this puts them at really high risk. High risk to go back to the streets, high risk to be moving around on the streets trying to earn money so that they can eat. It's all well and good to say self-isolate and stay at home, but if you don't have any resources at home, you can't. You have to go out, and in going out you're putting both yourself and your community at risk. I really, really, really wish I didn't have to be doing this right now. I know that the world, everywhere, people are suffering, and it would not be my ideal wish to be having to ask people for money at a time like this. But unfortunately we've got no other choice. We're a small charity, we don't have big reserves that we can turn to right now to help us in this situation, so we are having to come to you and ask for any way that you can help to support us. We don't know what is coming, but all we can say is that we are 120% committed to keep being there for these young people the best we can. What we want to do is to be able to give out emergency supplies to people, particularly food and hygiene equipment like soap. You can't wash your hands if you don't have soap, and make sure that some of the people who would be most vulnerable to ending up back on the streets to try to survive don't have to do that through this crisis. Also within Uganda you have to pay for medical care, so we'd also use your money to create a pot so that if some of these very vulnerable people do get sick, they do have someone they can come and turn to, and we can try and help save as many lives as possible. We don't know where this is going. We don't know how long this is going to last for, but from what I've seen across the world, this is bringing out the very best in many people. People are coming to me and they're asking me, how can I help? What can I do? I have hope. I do think that we can overcome this if we work together as a community, if we follow the right government advice. And part of coming together as a community is helping those most vulnerable. So if you are at all able to help, please do. If you're not able to help, perhaps you could please help to share this message so that we can reach out to as many people as possible. So if you are able to donate, we've set up a special emergency appeal page. Or you could also go to our website, and we've got all the different details of how you can donate there. Anything you can give, honestly, we will make it go as absolutely far as we can, and it will be really, really deeply appreciated. I just want to end on a message of just wishing everyone out there the best of health, and please take care of yourself, take care of your community, do the best. We must all do the best that we can, and from the bottom of my heart and everyone at S.A.L.V.E, any support you've been able to give us, we're really, really grateful. Thank you and good luck.